What's this? Yes, it's a Nerf brain. And it says Hooper's brain. This brain I actually use in clinic with clients who have problems, because many people I see who have brain injury or stroke or disease have had their disorder explained by someone who's gone to school for 432 years and can't explain it. I'm a much simpler person, and I drew little things on the brain, and I can explain the brain. But this really is about the size of my brain, maybe a little bigger, but it's about the size of an adult male brain. And the fat part of the brain is in the back or posterior area. So if we could, again, take a chainsaw and cut off my head right here and set it aside, this would fit down in there. On the left side of the brain, for 99.9% of you, is an area which controls language. It's interesting, if you took the brain apart in a dissection, the left and the right half look exactly alike. But in what they do, they don't function the same. Mm-hmm.
How about those who are ambidextrous?
Well, you're the confusing people. Ambidextrous means you can use either hand. And in the old days, before we had human subjects committees, some researchers used to take prisoners and do brain research. There's a famous couple, Penfield and Roberts, who wrote a book called Speech and Brain Mechanisms. And they did this in the 50s. A lot of prisoners back then had frontal lobotomies, and they would go into the brain and zap parts of the brain with electrodes to see what that part of the brain did, and they learned a lot about the brain. The problem is most of those people did not give permission for that to happen. Now, today, if you have a seizure disorder or a brain tumor, often the neurologist will go in and zap portions of your brain to see what they do, mainly to help take care of you, but they learn a lot about the brain that way. And the ambidextrous people are really interesting because you never know where things are controlled.